10,000 students, then for the 10,000 students, that's a parameter. Height is a parameter. Weight is a parameter for the population. And when you talk about the sample, it's a variable. That is a very simple difference, right? So, variable word is used and sample, and based on sample, when you are forecasting is for the population. The second question is, what is the use of standard error of mean? Anyone can tell me that? Very simple. What is the use of standard error of mean? Any answer? That is to find out two things: population mean, as well as second is to find out whether sample is representative or not. Now, let us take your case. Mansa, can you tell me what is your subject of interest, or which topic you have taken for project proposal? Can you tell me that? At least tell me that, are you listening? Can you unmute? Radhika, have you narrated your the project proposal is over or anything remaining in that? Is it possible for to unmute and tell me?
No, sir.
Hello.
Can you tell me something about your dissertation or research work? Are you- Just a minute. Just a minute. So what I wanted to discuss about all the three dissertation, four dissertation, how can we convert into a multicentric? That is the point. So uh, just give me 2 minutes. Can you see this basic course in biomedical research? Can you see this? Swayam, this is a free basic course in biomedical research. It's very interesting. My screen is visible to all of you. Radhika ji,
Yes,
can
sir.
you
Yes,
see the
sir.
screen? So, have you done this course?
No, sir.
Dr. Grivran, Dr. Mansha, anyone?
No, sir, no, sir. So
Not,
last
sir.
time you
Not
told
done.
that that would be a free certification course. You were going
Yeah,
to share
right.
some sort of online link, but we haven't
So,
received it
I
yet.
could not do the day before yesterday, so I just saw you live, right? You can just write a basic course in biomedical research and you will find this. So, if you can uh, give me 5 minutes, I would like to mute myself. Just 5 minutes. So, with a mobile or whatever instrument you have, just go into depth. After 5 minutes, again I will talk. Right? Just let me mute myself for 5 minutes.
ના ના મેં તો ક્યારનું કીધું કેટલાય ધંધા કરી નાખ્યા આપણે
અમારે તે રસ્તો કાયમ નહીં.
એકદમ રોડ ઉપર એક બાજુમાં જ.
Thank you for the having patience. But then I think you have seen this, right? So, Grivan, how do you find this website? Grivan? Hello?
ચલો મેં થોડી
Uh,
જોઈએ વાત કરી લઈશ.
બધી જગ્યાએ
Radhika ji, you are here now. Come back to the session, yeah, Grivan.
This course is absolutely fine. This will be having great
Yes, sir.
skills
I'm
as
here.
well.
So I request all my students to undergo that, because see, my purpose of these few hours is sensitizing about statistics, uh, at least basic understanding, etc. But then if you people at least meet once a month for the only purpose of criticizing each other's method. And wherever you are there, at least once a week, you should keep offline meetings in your department, etc. Everybody brings one journal, one article, they must read it and criticize. Then only you will learn epidemiology and statistics. That is the way to go ahead.
Exactly, sir. This is the correct way. This is the correct way what you just guided us, sir.
And we did our post graduation in Surat Medical College, including professor. All the 10, 15 people, everybody has to read one journal. And without opening journal, we have to present orally. At that time, no PPT were there, no LCD projectors. So we need to present orally, we have to remember, and then we need to criticize them. Other people will also criticize. Now let me ask you one question. If you don't remember that or don't know, I would like to teach that. See, when we have, let's say, around large population like 30 lakh population, let's say, in that you want to find out the any coverage, whether vaccine coverage or disease prevalence, and somebody wants to find out that, or any such characteristic, whether the people are getting advantage or not, where people go for their treatment, the Ayurveda or allopathy or government or private, all these things, if you want to evaluate, you have 30 lakh population and you want to do it very fast. And almost you need to date, let's say 2% here or there. Then based on that, you can decide standard, right? So the quickest mode to do this, right? Which will the sampling method for this purpose? Which sampling technique you will be using it? Anyone? So there are two quick methods. One is lot sampling, right? And other thing is cluster sampling. So the cluster sampling and the lot sampling technique, as such, the initial part is almost same. The only thing that the in a particular population, whether you are selecting one individual or two individuals, or you are selecting clusters. I repeat, in cluster sampling technique, let's say for the time being, I'm taking the Vadodara as in Vadodara, let's say 30 lakh population is there. And you want to find out whether the person was how much they did spend. Let's say, take it this way. How much that person had spent money for the purpose of the whole year for health or sickness, right? To remain healthy. So medical expense in a Baroda, we want to find out. So at that time, we'll not be able to use lots quality assessment because you need to forecast the parameter. But if you want to find out whether there is out of pocket expenditure is there or not, right? If you want to find only that, yes or no, in that case, lots quality assessment you can do it. You need to take only 19 individual, but you want to have still the want to find out the percentage of people covered. So lots quality assessment will only tell you whether this many percentage cover is there or not. But what is the coverage? That if you want to find out, you need to go for cluster sampling technique. In cluster sampling technique, it is much better if you select 40 cluster and 6 individual in each cluster. That is a better method. Initially, in our days, we used to take a 30 clusters and 7 in each. So 210 people we were taking. Now, the better is go for 40 cluster and 6 individual in each. So the total is 240 is the sample size, right? But this can tell you the coverage of the Baroda. Now, my question is this. Grivan, would you like to ask something? Your hand is raised, probably.
No,
No,
sir,
it
no, sir,
isn't.
no, sir.
No, this is my cursor was there. Anyway, so uh, suppose in Baroda, I have taken the clusters. Now, one cluster is in out of 6, 3, other 6, 2, something like that. So, need to remember that individual cluster doesn't represent that area. But together, the 40 cluster do represent the Vadodara. It is like that. So, I would like to show you the Excel file again, combining both the things. If you want to go for lots quality assessment, what do you do? If you want to go for the cluster sampling, what do you do? So, out of all the three participants, are you comfortable with this? Any one of you to do the sampling with this cluster sampling or lots quality assessment? Anyone? Radhika ji, are you comfortable? Can you do it independently? Or answer me, have you seen that Excel file where we are using for lots quality assessment? Have you seen that Excel file, Dr. Mansa?
No, sir.
No, no. So
No,
I will
sir.
show you, and this is very important. Tomorrow morning, at least, you should go through it. And I don't know the when we'll have a next session, but then in September or in October, we'll again start this batch. You can join anytime. And if one of you will write me in the group that after 1 month or so, yeah, we'll need some practice to yes, agreed. So after 1 month, so if you remind me, let's say one session on statistics where we just do nothing but the skill development, doing the analysis with AP info, taking a sample size, preparing the formats, all this. Because now we have at least basics in theory. So let me share you with one file where you can use both lots quality assessment as well as cluster sampling technique. Now, I hope that all of you are having this. The some of you can join as a faculty, huh? Next time when I keep a session, if you write in the group that you would like to take this topic, I prefer that out of 12 sessions, all the 12 sessions may be taken by all of you. About these are the two files. My concentration today is on this. And apart from that, can ask me any question. If you are ready with your study, you want to ask any question, that is okay. But this you must know very well. Because you have, let's say, 10,000 students in university or 2 lakh students in university, and you want to take a quick decision. This is very good. Now, so let's remember that this is an Excel file. One thing. In this, it is already given to you. The program is already written. If you want to see how the program is written, right? This is a village. This is village value. This is only a population, and this is cumulative population. everywhere the formula is written over here. You can see over here. Here there is no formula. So column, the randomization is written over here. This is the simple name of the village, no programming. This is the population, no programming, right? But here it is a cumulative, so programming is there. Cumulative sample is also having the programming. You can see the formula, and here is also programming. You can see the form, right? So now, suppose you have your data. So try to take data like this: name and population, right? See, you don't need this. So I am going very slowly, that from whatever data you want to take, you keep your data like this. Or I can make this name and population. It could be the name of the class, it could be the name of the college or name of the ward, like this, right? So for timing, let's say that we have class 3, class 4, English medium, Gujarati medium, like this, right? You have 27 classes. You can name it. And you have different population, 3,000, 1,000, like this. So you will have the classes and the number of students. Such a data you can have it. Right? Now, so you have two things, the class as well as population. Now, you have original seat over here, and you have original seat over here. This you can copy, move or copy. And at the end, give the name of that university. Rename. You want to do study in university. Uh, so university you are doing this study. So what you will do, this name and the population, you take out over here, right? And this is the set where you will find that. So you paste it over here, right? You're pasting over here, and you remove rest of the things. It will be up to something like 2,500. It is still that. So you are removing that. And we have done some mistake. Let's see and clarify it. So the mistake which we did over here, let me tell you, in university, we deleted the rest of the portion that we should not have done that. So here, what we can do, it over here, so we can do delete this two columns, right? The area and the population, but we should not have deleted rest of the thing. So that was the problem. So we could not find this. So let us delete this, right? Again, let's copy the original. Copy. Okay. And let's say the Education Institute, whatever the name is, we are working in that. So we did a copy. Then we have this data with us. I'm using probably after 7 or 8 years this actual practice. Now, no more use, but because you are doing, you will require this. Right? Now, to delete this data below this. So now one thing is very clear. Open this Excel file given to you. You copy the original sheet over here, and then you keep your data ready. Which class, how many students or how many population, you copy and paste in this. And the name and the population. You don't touch the rest of the first column or any other column. Now, here you want to do lots quality assessment, select 19. If you want to be more sure, you can go for 23 or 24 like this. But let us keep it 19. So now you will know that from where you are supposed to select the sample. So this is the first, this is second, such 19 samples you will get it, right? You will get the samples. This is the last one. This is okay, you got it. Now, these 1% or 2%, if you increase the population size over here, let me tell you that you are keeping it 10,000 over here. So what will happen? You need to select 3 individuals in the same population. Otherwise, if you keep it 5,000, this is 2. So usually what happens that it is not that much variable. So one sample. So this one sample, one individual you need to select from this much population. Then this one from this population class 10. And that by simple random technique or by the simple random sample or there is something geographical, you can randomly select that individual. So that is how these 19 individuals we are selecting. Now, same thing if you want to go for cluster sampling technique, then the word 19 instead of that, we write 40. 40. So in that 40 cluster, here we need to find out 2 cluster. From this, we need to find out 3 cluster, 3 cluster, 1 cluster, 1 like this. This is how it gives total 40 clusters. right? This is a total 40. And suppose you want to have one cluster, but you need to have six individual, then out of 645 people, you try to six individual you should select. So that will give you the total number of 240. Suppose you want to get 30, you can write down 30. So you get from where you need to take a sample, one, two, how many clusters to be selected. And that is also from each cluster, you try to select seven individual. So most of the time, the village or anything you select, it will be not too much varied. Mhm. And need to see that the clusters are identically, that will be better. So this is how we do the sampling, right? Now talking about the interpretation. How do we interpret this? Read the things. And in interpretation, we go for another file. And that file is decision rule table. If you understand this very carefully, it will be useful for whole life. It will take some time to understand. See, here it is a coverage 10%, 15, 20, like this. Up to 80, 85%, it is like this. Now, once we have selected 19, so out of 19, if 12 says that, in our case, they are having out of pocket expenses. They do out of pocket expenses. And it is a 12. What this mean? So 19 out of 12, they are doing out of pocket the expenses. That means that 75% onwards, 75% on 75, 80, 85. So the 19, 12 out of 19 are doing. That means in any case, 75%, 85, 85%, that will not be there. The people who are doing out of pocket expenses are less than 75%. This is, or other way. If you say that out of a 1 lakh pregnant woman, if this is 19 women, 12 women says that we are getting iron folic tablet. That means the coverage of iron folic tablet is not beyond 75%. It may be 74, 73, 71, something like that, but it is not more than 75%. That's what it means. At the same time, if seven individuals, let's say out of 19, seven pregnant women had received iron folic tablet, then what is the interpretation that the iron folic tablet coverage is 50% or less, but not beyond that. So just by study of 19 individuals, you can say confidently that how much coverage will not be there. This is a very quick method. The same table is not applicable in cluster sampling technique. In cluster sampling technique, if you have, for example, with a cluster sampling technique, if you are, let's say, imagine there's a 80% coverage in out of 240 people, then you need to apply standard proportion, add plus minus 2 standard proportion, find out a population proportion. That's the way to find out coverage based on a sample in cluster sample. While in this, the lots quality assessment, it says that whether this much coverage is there. So this is in nutshell two things together. Any question? I hope you have received this file and try to go through this file. So, if you need any further discussion, I am here. I hope all the three. Dr. Mansa has not spoken anything so by now. I don't know whether you are listening or I don't know about your topic also. Can you give me answer?
Yes, so I had previously told you that I was thinking about the dissertation on women who are aware about the artificial reproductive technology.
Yeah, I
So I
understood.
wanted, yes. And
So,
I also
that,
wanted to ask you regarding this
mm,
biomedical research study course that
course.
you just
Yes.
told us about. So is it that only for people who have already pursued post graduation, or people who have just
No,
done
it is
UG also
even
can?
even even 10th standard pass, even an illiterate person can also do this course. It is fully
Okay,
free,
okay, okay.
and I would definitely say that you definitely do it. And I'm sure that you'll have a problems. And when you have problems, you can say, share me your problems. I will go through it again and will come back to you. So you definitely do it and you
Okay,
can do it and you suggest your students, etc. also.
right. Yes, sir. Thank you.
I wish that you prepare a Google form to collect your data. And in addition to whatever population you stay there, you float it to others people also. Right?
Right. Yes.
So, Given you have anything to, otherwise I will be just stopping over here. But if you have some point to discuss, I'll be happy to do that. And if you do this biomedical course, it will be wonderful. Yeah, please.
Sure, sir. Sure, sir. I'll definitely look for this biomedical course. It is basically from ICMR, and also we have to secure some sort of percentage basis, that is 50% or more than
Yes.
that, in offline
Yes.
mode also. So that would be really interactive if I can
Mm.
mm, go through this course. And apart from that, sir, last time I also asked you and informed you that I'd be doing a new type of means a study, which will be basically based on BCG vaccination and how much patients have been, let's say, for example, if in a cluster I have 50 child and they have been vaccinated with BCG. So at what time they would be required a revaccination sort of things. So basically, I'm focusing on this right now, and this study has been going on from my side.
BCG vaccine, I think you'll get a lot of literature. But as of now, we say that BCG vaccine once given, that's okay. But then uh, there is a lot of dispute in that BCG vaccine to be given, not given. But at least in India, we say that at least the extrapulmonary tuberculosis it prevents. So
Exactly,
and
sir.
yeah, so
I found some papers regarding it
hmm,
that was stating that this study was already done in the Brazilian schools, and they were having coverage of around 2 lakhs children who were going to school, and the result was fascinating that they doesn't develop any sort of diseases related to tuberculosis or even extrapulmonary tuberculosis, or if they have developed disease, so that wasn't means what is called that wasn't fatal at all to them. So any changes you can suggest, sir?
yeah. What I
Any
suggested
changes?
before you go for this, no, there will be a lot of things. Immunity measurement, also of things, mental stress and visit tests, and so many things. But the quickly you can go through the already those who are having extrapulmonary tuberculosis. Look whether they
Yes,
had
sir.
given BCG vaccine or not. Right?
Okay, sir.
So
Sure, sure,
here
sure.
it will be something like a case control study, and but then you will get that external cases, you will get the normal people, you will also get the pulmonary tuberculosis. Three groups, if you compare, probably quickly you will understand whether the BCG vaccine was given or not. Right? So
Yes, sir.
and
Sure, sir.
try to involve others. So within a 1 week or 2 weeks, your data collection completes, right? And
Sure,
consider
sir.
this as
Sure.
a pilot. When you involve multiple people without stringent the training, etc., that's your pilot study. But then
Yeah,
you
sir.
out of pilot, you will yeah.
That is the main problem I'm facing. So for that, I have developed ODK form, and through the ODK collector app, I can have a lot of data over there. But
Yeah.
that is hampering my study just because ODK form etc. cannot be means fulfilled by this villagers. That can be fulfilled only by who are having Android phones and all.
But then see the AP info also you can try probably. That also AP collect is the tool. AP collect you can do it in
Mhm.
any language, Gujarati, in English. That's what I understand. Because
Okay,
AP info
okay,
software we can do it in Gujarati, so AP collect also or Hindi, what that matter. So villagers will be able
okay,
to use it. AP collect use that app is very good. And if
okay, sir.
required, you can also use the Google Sheet, which supports the mobile phone also, and the Google Sheet also you can collect rapidly, right? And
Sure, sir.
always
Sure, sir.
when you have a online data collection, 1% or two
Yes,
or
sir.
even 5% you telephonically find out and come confirm, and you say whether is the concordance is there or not, or you can use the Kappa score for that matter, agreement yes or no like that.
Okay, sir.
Very
Sure,
good.
sir. Sure, sir.
राधिका जी आपको कुछ बोलना है?
Yes, sir. Definitely I also go for this course, and I'm trying to understand what you are discussing with Dr. Grivan Rekwa.
Yeah. So let us call it a day, but continue to share your ideas and everything. And my wish is that if sometimes possible, maybe in October, December, somewhere in Ahmedabad, uh, I would like to invite all the students over here, offline interaction. And my wish that I talk much about the null hypothesis, the normal curve, standard error, etc., just for the standing the basics, and then really doing some quick exercises, in that we really do the result there and there. We can do the things, do the analysis, etc. And also, some of youngsters should know about GIS, Geographical Information System, where you can collect the geographical data with the database attached with that and show in the graphic manners the geographical and when you prepare several layers geographical one, two, three, four, 10 these types of distribution, take up permutation, combination of water supply and disease or electric supply and disease, solar system, something like that, ecological correlation. That will be the day where you will be enjoying the statistics still more. So geographical information system, particularly QGIS is a free software, QGIS. And that you can download and use it along with the module, but the ArcGIS is very costly affair, 8 lakhs or something like. So you can start with QGIS. Some of you can the download it and start using it. The only problem will be getting about the layers in that, but that can be solved over a period of time. QGIS is a software for geographical information system. So thank you all. I may take your leave, right? Okay.
Okay, sir. Good night, sir. Thank you so much.
Thank you, sir. Good night, sir. Thank you, sir. Good night.